Hello and welcome to another 5 Minutes With, and it's Dr Phyllis Murphie PhD, and we're joined by Dr Adam Rathbone from Newcastle. Adam, please introduce yourself.
So my name's Adam Pattison Rathbone, and I'm a clinical academic working in Newcastle. So I work across Newcastle University School of Pharmacy and the Newcastle upon Tyne Hospitals Trust in the Paediatric and Regional Sleep Services.
Okay, so tell me then, because we're talking about 5 Minutes With, and it's all about trying to push and promote and make people participate or help people participate in the awake check. What do you think the purpose of it is? How does it connect for you?
Yeah, so Awake Check is, I think, an initiative to get some good data about the comorbidity that some people have between obstructive sleep apnea and insomnia. So we know that insomnia is a condition in its own right. We know that obstructive sleep apnea is a condition in its own right. But what we don't know is how many people have both conditions or symptoms of both conditions. So this project is hopefully going to give us some good data so that we can understand how those two diseases interact with each other, and then come up with better ways to support patients who have both of those diseases. I think that's important for me. So I'm a pharmacist, as I mentioned, and pharmacists are involved in supporting people who can't sleep. So people with insomnia come to pharmacies quite a lot. People with sleep apnea also come to pharmacies quite a lot, complaining of some of the symptoms of that, like headache and feeling tired. And sometimes pharmacists don't necessarily think about sleep apnea as something they need to screen for. And so me being involved in this project is really important because I can bring it to the pharmacy profession and try and get pharmacists involved so that they're thinking about sleep apnea as well as insomnia when they're offering over-the-counter advice and support.
Absolutely, not just treating subjective snoring.
Yeah. Exactly. Yeah. So people will come in and they might say about a history of snoring, or their bed partner might be telling them they snore. And pharmacies offer lots of treatments for snoring. Things that you can buy and boil and use during the night. But realistically, we need more data to know, what type of services pharmacies should be offering to support patients with sleep apnea and insomnia. And then how we should support those patients is really important, and we don't know how to do that yet. So first we need to find out how many patients there are. Yep. Are they coming into pharmacies, and then we can start looking at services to support them.
Absolutely.
That's exactly what we're aiming to do, Adam, is to get the amount of patients recruited into the Awake Check study, and then we can look at responses from the general public. We can look at responses from the healthcare professionals, because they're affected by sleep disorder breathing as well. And then a follow-on study after that to actually say, what are the core competencies that a pharmacist should actually have to be able to screen and ask the right questions in community pharmacies, so we get them at the front door and not at the back door of the service, which is what's happening right now.
Yeah, exactly. That's a really good point. I think a lot of pharmacists will, have learned about sleep disorders when they've been at university and they've done their training. But
really, you think a lot of them would have learned that?
Well, I think we definitely cover it in the curriculum. I don't think we cover it in as much detail as you probably want us to, but we do cover it a little bit. We do cover it a little bit. I think that pharmacists' awareness of sleep disorders is growing day by day, and more pharmacists are getting engaged with sleep. More pharmacists are getting sleep trained, and that just means that they can offer patients more services. And
evidence-based services.
Yeah, community pharmacy is a really difficult place to be at the moment. There's lots of pressure on the system. There's lots of pharmacies closing. And so pharmacists are really, and their teams, because there's pharmacy technicians in pharmacies as well, they're really squeezed. And so sometimes it can feel a little bit like, it's another thing that pharmacists have got to do. But I think because insomnia is such a common thing that people come into pharmacies with, looking at sleep disorder breathing alongside it makes sense. It's not a massive add-on to what community pharmacists are already doing. It's just making what they're doing already a bit more evidence-based and a little bit more robust in terms of...
And then they could make a business from it, because people are presenting there. There's a commercial opportunity. It's not just adding to the workload. Anyway, at that note, let's wind it up. say thank you very much, Dr. Adam
Thank you
Rathbone, for joining us for
Adam.
5 minutes with.